Hi friends, good evening and we'll see important points for exam. This is the video number 42 of important points section. Today we are seeing an important topic on lumbar puncture. We'll see what is lumbar puncture. Lumbar puncture is the insertion of a needle into the lumbar region of the spine. So, in short, it is an insertion of needle into the lumbar region of the spine. And the site of lumbar puncture is between L3 and L4 or L4, L5. Usually, the site is L3, L4 or L4, L5. And the purpose of lumbar puncture include to administer spinal anesthesia, mainly for spinal anesthesia, and to administer medication. For giving special medication and to remove fluid, that is CSF, cerebrospinal fluid, or blood or pus, that for removing fluid, and to measure pressure of CSF, cerebrospinal fluid pressure also we can measure through lumbar puncture. And next is the complication, that is after lumbar puncture what are the complication can occur. Injury to spinal cord and spinal nerve, there is a chance. And infection can also occur, that is due to infection meningitis will come, and also leakage of CSF and damage to the intervertebral disc, there is a chance of damage to intervertebral disc, and also there is a chance of temperature elevation and local pain, edema and hematoma, and rapid reduction in intracranial pressure. These are the complication. And next we will see what is normal CSF pressure. Normal CSF pressure is 6 to 15 mm of Hg or 80 to 180 mm of water, H2O. This is the normal CSF pressure. And next we will see contraindication. What are the case we can do this lumbar puncture? First one, elevated intracranial pressure. Second one, uncooperative patient. Third one, infection near to intended puncture site, that is any infection on the puncture site, and also severe degenerative joint diseases in case of any joint disease, and also there is a coagulation abnormalities. These are all the case we can't do lumbar puncture for the patient. Physical findings, color and appearance of CSF we can see. Normally CSF is crystal clear color, and turbulence indicate infection. If it is, that is turbidity of CSF indicate infection, usually meningitis. And if blood is present, blood indicate there is a chance of hemorrhage. And cell count we can see, normally no RBC in CSF, that is crystal clear color, and the presence of RBC indicate hemorrhage. And increasing number of WBC, white blood count, indicate infection. And tuberculosis and viral infection may cause increase in lymphocytes. So increase in lymphocyte count indicate there is an infection, usually bacterial or viral infection. And pyogenic infections cause increase in polymorphonuclear leukocytes. And sugar count we can see, normally 40 to 60 milligram per 100 ml. And in case of bacterial infections such as tuberculosis and meningitis, often lower the sugar count. So sugar count will be low in case of bacterial infections such as tuberculosis and meningitis. And next we will see chloride count. Chloride count usually 720 to 750 milligram per 100 ml. And in case of bacterial infection, that lower the chloride count. So in bacterial infection also chloride count will be less than normal. And next we will see protein level. So normal protein content is 30 to 50 milligram per 100 ml. And in case of degenerative diseases and brain tumor, the protein content is increased. In case of any degenerative diseases or other tumor, the protein content will be increased. And as soon as the needle is withdrawn, that is after lumbar puncture, seal the puncture site to prevent the leakage, and also place the patient in supine position for 12 to 24 hours. So immediately after puncture we should place the patient, seal the area and place the patient in supine position. And after lumbar puncture, patient should be washed constantly for color, pulse, respiration, nausea. So after lumbar puncture, continuously, constantly for several hours, we should monitor patient pulse, respiration, blood pressure, nausea, and patient is having any headache or any discomfort, we should monitor. So these are all the important points regarding lumbar puncture. So question can come from this area. So we can expect questions from this area.